Thank you, Mr Speaker. I rise this afternoon or this morning to speak on this matter of public importance. There is nothing more important in our community than the health of our community, the education of our community, and that members of our community, as we have so heart-wrenchingly heard this morning, have a safe place to call home. And within health, education, housing, the health budget is an area for us to look across in this week as we make our budget replies and we scrutinise what the actual budget papers say versus what ministers and others from across the other side say verbally about the documents before us. And on that, if possible, just with eye contact, if I could confirm from the Premier Minister for Health whether, in fact, in his comment about the cuts, he said that there had been a transfer from the health budget of $250 million to the Treasurer's Reserve, and that was what accounted for the documented cuts in the health budget as we're allocating and looking at this week. I'm not getting any contact from the Minister from Health, so I will assume that was what he said. So I, at my first glance across the budget papers as they were delivered last week, noted with great interest that in fact the health budget did indicate a reduction in investment from this government. It's in black and white, and the Minister for Health might stand this morning and talk about moving the deck chairs, but the reality is that the estimated outcome for the health budget in the 2021-22 year is $2.7 billion, and in the 2022-23 it's 2.6. There's actually a reduction in the indicated spending for health of $126 million. Now, some people in this place might not feel that that's a material figure. Some people in this place operate and live in such a bubble that they forget the impact and the reality of these vast numbers that we deal with and talk about all day, every day. But the reality is it's not just that there's a cut recognised in this budget in the 22-23 year, but further again, compared to the position as an estimated outcome in 21-22, there is also a cut in the 23-24 year of some $53 million. Again, and I question if this government see that that number is not material. It in fact speaks to allocations that we are discussing all the time of where $50 million could make a big difference in our community, but also, curiously, as I speak a little later about the Launceston General Hospital and investments there, the complete figure that is invested in what they talk about as their second stage of the master plan, which was meant to be $580 million investment as talked about in their budget papers. But it seems that budget papers can say one thing, you would assume that that's fact, but members and ministers can stand and say anything. So I would like a clarification if that's in fact what the Health Minister said, and if there is a moving of the deck chairs, because when you go back and look at the Treasurer's Reserve in the documents, there's only $150 million allocated in the Treasurer's Reserve. It's what was allocated last year. Going forward, there'll be only $50 million each year allocated, and so that movement doesn't make sense. What also doesn't make sense is that when the Launceston General Hospital is under so much pressure, when its results, not for want of trying or not for the passionate delivery of services by our incredible nurses, our paramedics, our support staff in the hospital, we unfortunately see really bad outcomes. Bad bed block, bad ambulance ramping, extraordinary waiting lists. We see and we've heard personal accounts this morning from our Shadow Health Minister around the impact that nurses are feeling. I have friends and family working in the LGH that are expected, sometimes, and I'm sure it's not for the normal way of behaving, but feel like they're guilted into doing extra shifts. People that have just started in the career and said, I cannot believe that when I started this, if I knew what this was like, I would never have entered this area. People that are leaving the sector, and we just can't afford to do that. People that are choosing to take leave because they can't cope anymore. Managers that are taking leave because they can't cope with the pressures. What does that say to the people that are working in their teams? It's an extraordinary set of circumstances that we find ourselves in the Launceston community, I'm sure no doubt in other communities across Tasmania. But when we've got such dire situations, the community, they look to leaders for honesty, they look to leaders for integrity and to tell the truth about the realities so that they can trust that real action and real work will happen. And so where 2 elections in a row, an announcement is made of $580 million for the further development and redevelopment of the LGH, they expect that actually to be a reality. When you read your budget papers, and I'm sure many Tasmanians do, there is a statement of fact in here, and it says funding of $580 million is allocated. It's not allocated. When you actually read the papers, and I can remember being absolutely dumbfounded in my first year here in Parliament last year, where I went to actually reference some of the commentary that was in the budget papers to the actual allocation in the line item, and that line item for the LGH Stage 2 of the master plan, which was this, I'll bring in the votes by announcing $580 million, had $0 allocated. 4 dashes along the line with 0 allocations. Well, it's actually not much better this year. Again, these massive announcements and determined statements of investment. When you do the maths, just in the 22-23 year, $2 million. $2 million. Then five. And I talked about $50 million. $50 million is a lot of money. $50 million is the amount that the cut continues to be from real terms 2 years ahead in the actual health budget. But it's only merely $50 million of the $580 million that this government said it was going to deliver. Now, people in Launceston and Northern Tasmania, they are used to the way that this government makes announcements to try and please the community. There's announcements about the Tamar Bridge, not in the budget. There's announcements about dredging. There's announcements about the LGH. Our community deserve better. There are real cuts in health at a time where our system is in crisis, and the people working on behalf of our community need greater respect and greater care.